I'm Dr. Coleman Martin, a neurointerventional specialist at the St. Luke's Neuroscience Institute in Kansas City, Missouri. This is Interventional Stroke Rounds. Today we have a woman in her 40s with an uncommon type of stroke. If you've been following stroke rounds, you already know that the heart pumps blood up the arteries of the neck and into the brain. The most common form of stroke occurs when an artery becomes blocked by a clot, depriving brain tissue of oxygen and nutrients. But arteries are not the only place that trouble can occur. Arterial blood enters the brain tissue and has to be carried out of the head through a network of veins and venous sinuses, which return the depleted blood back to the heart. These venous sinuses can also become blocked with clot. Such a blockage causes blood to build up in the brain, which can lead to bleeding in the brain. Our patient presents with headaches over the last week, progressing to right arm weakness and confusion. CT scan shows bleeding into the brain tissue and over the surface of the brain. CT angiogram and perfusion scans show that the brain is congested with blood and that the venous sinuses are blocked. Usually blood clots in the venous sinuses are efficiently managed with the blood thinners heparin and Coumadin. In this case, however, the stroke symptoms and mental status changes gave the consulting neurologist and I concerns that blood thinners alone may not be enough to achieve a good outcome. I performed an emergency angiogram which showed blood entering the brain through normal arteries. The blood was stagnating in the brain, unable to leave through the sinuses shown here. To remove the clot in the venous sinuses, I entered the venous system at the groin, bringing a catheter up the vena cava, past the heart, up the jugular vein and into the head. I find that the penumbra clot retrieval catheter is well suited for retrieving clots in this location. Here's an example of the catheter removing clot in a glass model. On the left, you can also see it filmed under X-ray. With suction applied to the catheter, the clot can be drawn out of the body. I've navigated the catheter into the superior sagittal sinus of the brain. The arrow shows the catheter tip as the clot is broken up and removed. This operation can take a few hours and is performed while the patient is under a general anesthetic. Usually several passes up and down the sinuses are required to remove enough clot to allow normal blood flow. Now I've moved the catheter to the sigmoid and transverse sinuses where the clot retrieval continues. After clearing clot from each of the venous sinuses, it is time to take another angiogram picture. Now the blood flowing into the brain can exit through the open venous sinuses shown here in blue. With the majority of the blood clot removed from the venous sinuses, blood thinners are started. A thorough laboratory workup is initiated to try to discover why this patient developed venous sinus thrombosis. Venous sinus thrombosis can be caused by several factors. These include, but are not limited to, infection, dehydration, oral contraceptive pills, and an inherited disorder of blood coagulation. At St. Luke's Hospital, we treat all kinds of stroke. If you or a family member has stroke problems, please come see us. The St. Luke's Neuroscience Institute is committed to stroke and interventional education. Feel free to share this video on your blog, Facebook, and Twitter. Another stroke, gotta go.